If you're over 60 years old and you've been struggling with constipation, I want you to ask yourself one very important question. Is this just a normal part of aging? Or is your body attempting to warn you about something more serious? As a medical doctor, today I'll demonstrate how to tell the difference. When constipation is harmless, and when it should never be ignored. This video could literally protect your health. So let's start with something very important, because many individuals misunderstand this. Constipation does not simply mean you don't visit the bathroom every day. In fact, normal bowel movement frequency can range from 3 times daily to 3 times weekly. And for many healthy individuals, both can be completely normal. Constipation becomes a concern when stools are hard, difficult to pass, or when you feel like your bowels never fully empty. Now here's why constipation becomes much more common after age 60. As we age, the digestive system naturally slows down. The muscles in the intestines don't contract as powerfully as before, so food moves more slowly through the gut. This is called reduced gut motility. Over time, the colon absorbs more water from the stool, making it drier, harder, and more difficult to pass. There's also diminished muscle tone in the abdominal and pelvic muscles, the very muscles that help push stool out during a bowel movement. On top of that, many individuals over 60 are simply less physically active. Less movement means less stimulation of the intestines. Another major factor is hydration. As we get older, the sensation of thirst becomes weaker. So many individuals don't drink enough fluids, even when their body truly needs it. Less water in means harder stool out. But digestion isn't just physical. It's also psychological. Stress, anxiety, worrying about bowel habits. All of these can tighten the gut and slow digestion even further. I see this often, especially in individuals who are anxious about not going every day. Now here's the key thing I want you to remember. Constipation itself is not a disease. It is a symptom, a signal from your body that something, lifestyle, hydration, movement, or health, may be out of balance. And in my clinical practice, this is one of the most common concerns I hear from patients over 60. Most of the time, constipation is manageable and often reversible. But, and this is very important, not all constipation is normal. And that's exactly what we'll talk about next. When constipation is normal and not dangerous. Now let's take a deep breath together, because this part is meant to help you relax. Not every episode of constipation is dangerous. In fact, many cases are what doctors call functional constipation. What does that mean? It means constipation that develops slowly, comes and goes over time, and often improves with simple lifestyle changes. This is the kind of constipation that is considered common, and usually not serious, especially after 60. Here's what normal constipation often looks like. You may notice that you visit the bathroom less frequently than before. But when you do go, there is no significant pain. There is no blood in the stool, and you're not losing weight without trying. The stool itself may be harder than it used to be, but it's still passable. It just takes a bit more effort or time. You might feel slightly bloated, a little uncomfortable, but once you have a bowel movement, there is a sense of relief. That pattern, mild discomfort, no alarming symptoms, and relief afterward, is often reassuring. According to research published in the American Journal of Gastroenterology, functional constipation affects approximately 16% of adults overall, but that number rises to 33% in adults over 60. This confirms what we see clinically. Age-related constipation is extremely common and usually benign. Now let's talk about common non-dangerous causes that can lead to this type of constipation. One of the biggest is diet. If your meals are low in fiber, not enough vegetables, fruits, whole grains, the stool simply doesn't have enough bulk to move smoothly through the intestines. Another very common cause is dehydration. Even mild dehydration can make stool harder, drier, and more difficult to pass. Travel can also play a role. Changes in routine, different foods, holding in bowel movements. All of these can temporarily slow the gut. Then there's physical activity. If you've been sick, resting more, or simply moving less than usual, your intestines move less too. Certain medications can also contribute. Some blood pressure medicines, pain relievers, iron supplements. They may cause minor constipation as a side effect without indicating anything dangerous. Now, here's the key point I want you to remember. If your constipation improves when you drink more water, eat more fiber, or move your body, that is usually reassuring. That tells us the digestive system is still responsive. It's reacting to habits, not disease. In my experience as a doctor, this is the most common situation I see in adults over 60. And the good news is this type of constipation is often manageable and sometimes completely reversible. But there are certain signs that do not fit this pattern. Signs that suggest constipation may be a warning, not just a nuisance. And those are the signs you should never ignore. Let's talk about those next. Medications that cause constipation. Now, this next part is extremely important, especially if you're taking daily medications. Because for many individuals over 60, constipation is not caused by aging alone. It's caused by the medications meant to help them. In my clinical practice, this is one of the most overlooked reasons for chronic constipation. Let's talk about the most common medications that can slow down the bowels. First, blood pressure medications. Certain types can relax blood vessels, but at the same time they can also reduce intestinal movement, so stool moves more slowly and constipation gradually appears. Next, painkillers, especially opioid medications. These drugs don't just reduce pain, they also directly block nerve signals in the gut. The result? The intestines become sluggish, and constipation can be severe and persistent. This is one of the most powerful medication-related causes I see in older adults. A systematic review published in the Journal of Pain and Symptom Management found that opioid-induced constipation affects up to 80% of patients taking these medications long-term. This makes it one of the most common and debilitating side effects of pain management. Now let's talk about antidepressants. Some of these medications affect the same chemical messengers that help regulate bowel movement. So while they may help mood or sleep, they can unintentionally slow digestion. Another very common group is antacids, especially those containing calcium or aluminum. These can harden stool and make bowel movements more difficult, especially when used regularly. Individuals with Parkinson's disease should also be aware of this. Both the condition itself and the medications used to treat it can significantly reduce gut motility. Constipation in these patients is extremely common and often requires careful management. And finally, iron supplements. Iron is essential for many individuals, but it is also notorious for causing constipation. Stool may become darker, harder, and more difficult to pass. Now, I want to be very clear about something. Never stop a medication on your own, even if you strongly suspect it's causing constipation. But you should always inform your doctor if constipation started after a new prescription or after a dose was increased. Often there are simple solutions. Adjusting the dose, changing the timing, switching to an alternative, or adding safe bowel support. Now let's clear up a very common misunderstanding: laxatives. Many individuals worry about becoming dependent on laxatives. And yes, misuse can be a problem. But here's the truth. Occasional laxative use is often acceptable, especially for short-term constipation caused by medications, travel, or illness. The problem arises when laxatives are used daily, long-term, without medical guidance. That can make the bowels less responsive over time. So the goal is not to avoid laxatives out of fear, but to use them wisely and only when appropriate. In many cases, addressing the medication cause dramatically improves constipation, sometimes without needing laxatives at all. But again, not all constipation is explained by medications, and not all constipation is harmless. There are certain warning signs that suggest something more serious may be happening, and those are the signs I want you to know clearly. Let's talk about them next. Red flags when constipation is dangerous. Now, this is where I want you to pay very close attention. Up to this point, we've talked about constipation that can be common, manageable, and often harmless. But what I'm about to share does not fall into that category. There are certain signs, what doctors call red flags, that tell us constipation is not normal and should never be ignored. Let's go through them slowly and clearly. First, sudden constipation after age 50 or 60. If your bowel habits were stable for years and then change quickly and unexpectedly, that is a warning sign. Next, blood in the stool. This can appear as bright red blood or dark black stools. Both are abnormal. Both require medical evaluation. Another major red flag: unexplained weight loss. If you're losing weight without changing your diet or attempting to exercise more, your body may be telling you something is wrong. Pay close attention to pain. Severe abdominal pain, or pain that doesn't go away, or pain that wakes you up at night. That is not typical constipation. Now this one is often overlooked: pencil-thin stools. If stools suddenly become very narrow and stay that way, it can indicate something is physically narrowing the bowel. Another concerning pattern: constipation alternating with diarrhea. Going back and forth between the two is not a normal aging change. Listen carefully to this one: feeling like your bowel is never fully empty. Even after going to the bathroom, you still feel pressure or fullness, or the urge to go again. When this feeling is persistent, it needs to be checked. The American Cancer Society reports that changes in bowel habits lasting more than a few days, especially when combined with other symptoms like narrow stools or rectal bleeding, are among the early warning signs of colorectal cancer. Colorectal cancer is the third most common cancer diagnosed in both men and women in the United States, but it's also one of the most treatable when caught early. Now let's talk about fatigue. If constipation is accompanied by unusual tiredness, shortness of breath, or anemia found on blood tests, that combination is concerning. And finally, nighttime symptoms. If constipation-related pain, urgency, or bowel symptoms wake you from sleep, that is not normal. Let me say this very clearly. These are not normal aging changes. These are warning signs. Now, I don't say this to frighten you. I say this to protect you, because these symptoms can be associated with serious conditions. But serious does not mean hopeless. Possible causes include colon cancer, bowel obstruction, inflammatory bowel disease, certain neurological conditions, thyroid disorders, Here is the most important message of this entire video. Early evaluation saves lives. Many of these conditions are highly treatable and sometimes curable when they are found early. Waiting, ignoring symptoms, or assuming this is just age, that's what causes problems. If you recognize even one of these red flags in yourself or in someone you love, please don't panic. But do take action. Talk to your doctor. Ask for proper evaluation. Ask the questions. Your body is speaking to you, and it deserves to be heard. What to do next? Your step-by-step plan. Now that you understand what's normal and what is not, let's talk about what you should actually do next. I want to give you a clear step-by-step plan, one that empowers you, not overwhelms you. Step 1. Check in with your body. Before changing anything, ask yourself 3 simple questions. When did this start? Was it gradual or sudden? Are there any red flags? Blood, pain, weight loss, night symptoms? Did anything change recently? A new medication, a higher dose, less movement, less water? These answers give you and your doctor valuable clues. Step 2. Fix the basics first. Most mild functional constipation improves when the basics are done consistently. Let's start with fiber. Food comes before supplements: vegetables, fruits, beans, whole grains. Increase fiber slowly over days to weeks, not all at once. The recommended daily fiber intake is 25-30 grams, but most adults over 60 consume less than half of that amount. Next, hydration. Don't just drink water randomly. Sip fluids throughout the day, especially in the morning. Warm liquids after waking can gently stimulate bowel movement. Aim for at least 6 to 8 glasses of water daily, more if you're active or in hot weather. Now, movement. You don't need intense exercise. A daily walk, light stretching, gentle activity. These signal the intestines to start moving. Research shows that even 20-30 minutes of moderate walking daily can significantly improve bowel regularity in older adults. And here's something many individuals overlook: toilet posture and routine. Go when you feel the urge. Don't rush, don't strain, don't force it. A small footstool to elevate your feet can help align the bowels and make passing stool easier. This is based on the principle that a squatting position, or elevated knees, straightens the anorectal angle and facilitates easier bowel movements. Consistency matters here. Step 3. Know when to see a doctor. Now this part is very important. If constipation lasts more than 3 weeks, or if you notice any red flag, do not wait. Don't self-diagnose. Don't assume it's just age. Don't keep masking symptoms with laxatives. Early evaluation can make a life-changing difference. This also brings us to screening. Colon screening after age 50 is not optional. It's protective. And if your bowel habits change, even if you've been screened before, you may need evaluation again. Symptoms matter. The U.S. Preventive Services Task Force now recommends colorectal cancer screening begin at age 40 for average-risk individuals and continue through age 70. For those aged 76-85, the decision should be individualized based on overall health and prior screening history. Let me leave you with this reassurance. Most constipation in adults over 60 is manageable. Much of it is preventable, and serious causes, when found early, are often very treatable. Your body is not your enemy. It's communicating with you. Listen to it, support it, and never hesitate to ask for help. Thank you for staying with me through this video. Your health matters, and you deserve clear, honest information. Take care of yourself. Final message. As we come to the end of this video, I want to leave you with one clear message. Constipation after 60 is common, but it should never be ignored. Some constipation is part of life. Some of it is related to aging, habits, or medications. But knowing the difference, that's what protects your health. Normal constipation is usually gradual, mild, and improves when you drink more water, eat better, and move your body. Dangerous constipation is different. It appears suddenly, it persists, or it comes with warning signs like pain, blood, weight loss, or fatigue. That kind of constipation is not something to wait out. Your body is always communicating with you. Sometimes it whispers, sometimes it sends stronger signals. Learning to listen and to respond with care is one of the most powerful things you can do for your health. If this video helped you understand your body better, please like the video. Subscribe to the channel so you don't miss future health guidance. And most importantly, share this video with someone you care about, especially if they're over 60. It could make a real difference for them. And if you'd like to continue this conversation, in my next video, I'll explain the safest natural ways to relieve constipation without harming your gut and without creating dependency. Thank you for spending this time with me. Take care of your body. It's been taking care of you all your life.